I know these are usually quick procedures, right?
Heading down this hall to an operating room, a woman with the goal to support not only the patient, but also the surgeon, the nurses and the assistants, and even those handling all the paperwork.
Take another clip, please.
That's Sarah Crevens, the president and CEO of Sutter Health. She oversees the health care for 3 million people across Northern California.
This is his gallbladder.
We were in the OR to learn more about a robotic surgery program called the Da Vinci that just earned Sutter a special accreditation.
What'd you think? So it's incredibly impressive if you think just over the course of my lifetime, you know, things that were these big open procedures kept patients in the hospital for a very long time, and this is just remarkable. And it's an incredible thing, right, to think about that marriage of technology and then the human skill of the surgeon coming together to be able to do something like that. Thank you so much.
Nice meeting you.
Nice to meet you. Thank you.
Those who work with her say a human touch on a technical field has become a hallmark of Crevens' leadership. We sat down for an interview in a part of the hospital that looks nothing like a hospital, Sophie's Place, a place apart from the stress of medical treatment.
They just started a group for families of NICU babies.
Crevens has a wide-reaching mission for Sutter, including those who are outside these doors.
We're sitting here at Sutter Medical Center, Sacramento, and surrounding us are some really big challenges in the community in terms of care for the homeless, care for people with mental illness.
She helped launch a pilot project to send street nurses out to meet homeless patients right where they live. Programs like that can be expensive. Last year, Sutter invested $334 million to care for Medi-Cal patients, money that was not reimbursed. She's looking at innovation to save money, like using the ride-sharing service Lyft to move people out of waiting rooms.
We started with a pilot using Lyft for patients and their families on discharge who didn't have their own transportation, and it was really quite remarkable.
Sometimes it's her own experience that shapes priorities, like expanding office hours.
People talk about having an appointment after 5 p.m. as after hours. You know, as a working mom, I never went to the grocery store during the day, and I didn't think when I went to the grocery store at 6 o'clock at night, I'm going to the after hours grocery. I just thought I'm going to the grocery store.
It's rare to see a mom or any woman become the head of a large healthcare organization.
I don't know a woman in leadership who hasn't had the experience of saying something, 20 minutes later, a male in the room says the exact same thing, and everybody goes, wow, what a great idea.
Nearly 80% of healthcare workers are women, but at the executive level, that drops to anywhere from 20 to 40%, and far fewer become CEOs.
And since I've been in rooms in my past where I felt that people didn't hear me because I was a woman, I try to be very conscious of the fact that it's not just the person in the room whose voice seems the most credible or the loudest or who stands the tallest or dresses a certain way that has the best idea.
Crevens worked her way up. Early in her career, she cared for elderly and disabled people. She was on a busy executive track as she raised 3 kids. It all prepared her for an unprecedented emergency last October.
It is a very rare thing for a full-service acute care hospital to be evacuated.
Sutter Santa Rosa Regional Hospital was in the path of the Tubbs fire. Everyone had to get out. Crevens oversaw everything from communications to transportation, and then she headed out to offer some hands-on support.
Mostly I wanted to thank people. You know, when I went to Novato, which was a small hospital that doubled in census overnight, I met nurses that literally had gotten in the ambulance with their patient in Santa Rosa, rode in the rig, walked up to the new unit and started working, some of whom had lost their own homes. They took care of people, and you know, how could I do anything less?